Bismillahirrahmanirrahim. Today's my lecture is about pupillary light reflex. When sudden bright light is shown into the eyes, the pupil constrict, which improve the depth of focus. This reaction is called pupillary light reflex. It is a midbrain reflex. The functions of light reflex is to help the eyes adapt extremely rapidly in response to change in illumination. In darkness, this reflex becomes inhibited. This reflex is useful in increasing the amount of light entering the eyes when illumination is dim, which help dark adaptation. Pupillary light reflex is of two types, direct and indirect light reflex. At first, direct light reflex. Constriction of pupil due to fall of light directly on eyes. This reaction is called direct light reflex. Indirect light reflex means if light is directed on one eye, then constriction of pupil of other eye is called indirect or consensual light reflex. It is possible due to diverging of nerve fiber from one protector nucleus to both Erlanger-Westphal nucleus. Pathway or light reflex is slightly deviated from visual pathway. The fibers of light reflex and visual pathway are same up to the optic tract. Beyond that, these two sets of fibers are separated. The optic nerve fibers that carry the impulse initiating this pupillary reflex leave the optic tract near the lateral geniculate bodies. On each side, they enter the midbrain via brachium of superior colliculus and terminate in the pretectal nucleus, which form the center of light reflexes. Efferent impulse from this nucleus are carried by short fibers to ipsilateral and contralateral Erlanger-Westphal nucleus that contain preganglionic parasympathetic neuron within the oculomotor nerve, which is the third cranial nerve. From Erlanger-Westphal nucleus, preganglionic fibers pass through the oculomotor nerve and reach the ciliary ganglion. Postganglionic fibers arising from this ciliary ganglion pass through the short ciliary nerve and reaches the eyeball, that is, to the ciliary muscles, which causes contraction of constrictor pupil muscles of iris. This pathway is dorsal to the pathway for near response. The flowchart of pupillary light reflex is when sudden bright light fall on cornea, cone cells of retina receive this light reflex at first, then pass through the different layer of retina, then optic nerve, optic chiasma, optic tract, then one set of fiber ends in pretectal area and other set cross and end the Erlanger-Westphal nucleus of opposite side. Then ciliary ganglion, short ciliary nerve, then sphincter, pupil muscle which causes constriction of pupil. This is the figures of pupillary light reflex. Pupillary reflexes in central nervous system disease. A few central nervous system diseases damage nerve transmission of visual signal from retinas to Erlanger-Westphal nucleus, thus sometimes blocking the pupillary reflex. Such block may occur as a result of central nervous system syphilis, alcoholism, encephalitis, and so forth. The block usually occur in pretectal region of brainstem, although it can result from destruction of some small fibers in optic nerves. The final nerve fiber in the pathway through pretectal area to Erlanger-Westphal nucleus are mostly inhibitory type. When their inhibitory effect is lost, nucleus become chronically active, which causes pupil to remain mostly constricted, in addition to their failure to respond to light. pupil can constrict a little more if the irregular nucleus is stimulated through some other pathways. For instance, when the eyes is fixed on a near object, the signals that causes accommodation of lens and those that causes convergence of two eyes causes mild degree of pupillary constriction at the same time. This phenomenon is called pupillary reactions of accommodation. Okay, when a pupil fails to respond to light but does not respond to accommodation and is also very small is called Argyll Robertson pupil. It is important diagnostic signs of a central nervous system disease such as tertiary syphilis. But Argyll Robertson pupil is also seen in other diseases producing selective lesion in midbrain such as lesion in irregular nucleus or diabetes or alcoholic neuropathy. In the pathway of light reflex, at first we can say that light rays on eye, then optic nerve, then optic chiasma, optic tract, then projectile nucleus. From there, irregular nucleus, ciliary ganglion, short ciliary nerve, which causes contraction of constrictor pupil and constriction of pupil. That's all. Thank you for your patience sharing.